Our last rough sleeper count, which is a single night count, showed that we had 17 people on a single night. But that's not the totality of the number of rough sleepers, because people come and go, people find friends or family to stay with. Then the actual number of people who are in and out or permanently sleeping rough was over 40. So and the people who sleep rough are a very high risk population. They've got underlying health conditions and really struggle to access healthcare because it's something that they often put off until the very last minute and beyond. So hotels were probably the quickest way to house people, and hoteliers in B&NES responded really well to our requests and our appeal for help. But we took a strategic decision to do something that has the potential to be more sustainable. And make sure that the people that we are supporting felt like they were coming into a home. And that had the biggest chance then of success. So we have seen in other areas people being evicted from hotels and it being a really challenging picture because it's not a place that people are used to living in. So we took a bit more time than we were being granted by the government, but we then housed over 40 rough sleepers. So they've gone into accommodation locally that was set up, or they've been reconnected to their hometown. And working with B&NES Council, we identified 29 units of accommodation, which we set up in really quick time. And we worked with Curo to set up another 5 accommodation units for some of our hardest to engage, our most complex rough sleepers who've previously been turned down for accommodation. So, you know, it's been a real positive for lots of our clients because actually the end result of COVID has been accommodation. But during that process, we used local businesses. We were really keen to support the local businesses. So where possible, we had a local cleaning company. We sourced our white goods from a local shop in Bath. And since then, we've worked with DHI, who are the drug and alcohol specialists, and AWP, who provide mental health support, to make sure people were not only as prepared as possible to go into that transition and to go into the accommodation, but then they've got the ongoing support that they need to maintain it. So we've continued to provide food. We've got Manvers Street Hostel in the centre of town, and we've continued to provide food to all the 20 residents who are either staying at Manvers Street Hostel or staying at another provision. We're also delivering more than 50 meals a day, so that everybody has got at least one cooked meal per day across our accommodation. So that includes some of our other existing hostels as well. And we're continuing to provide out of the back of Manvers Street Hostel with really appropriate social distancing measures, food every single day in the afternoon. So people are able to access food through Julian House.